We're at the True North Health Center in Santa Rosa. I've been here for more than a week, having a great time, meeting a lot of people. And so I have the privilege of interviewing Dr. Veress, who is a naturopathic doctor. Tell us a little bit about what you do here and your story.
Sure. What I do here is I supervise inpatients through their water fast. I take people from anywhere from 3 days to 40 days on their water fasting journey. I also see outpatients and community members, and we also do long distance support for not only whole food plant-based, because we do a lot of nutrition education, but also managing and teaching people if they want to come here how to prepare for their water fast.
So yeah. What is a naturopathic doctor?
Great question. So a naturopathic doctor really focuses on getting to the underlying core of what's going on with a person's health. So we go through a 4-year medical school. We learn all the basic sciences, the biology, the physiology, and then we actually, the last 2 years, instead of just studying the pharmacology of how to administer drugs for certain kind of pathologies, we also learn hydrotherapy, we learn nutrition, we actually learn water fasting, which is how I learned about True North as well. Dr. Goldhammer came and spoke at our school. We learn about homeopathy, nutritional medicine in the terms of supplements as well, and botanical medicine. So we have a little bit more tools in our toolbox in order how to get people towards a greater sense of health. So
fabulous.
Yeah.
So I have a Facebook group where we are all talking about plant-based. A lot of us already are plant-based or have been for a while. A lot of us are brand new and just getting the hang of it and supporting one another. So I went to the group and I asked 4 questions for the various interviews that we're doing here at True North. And so I get a lot of questions about gut microbiome. What is the gut microbiome?
Yeah. So the microbiome is one of my favorite topics, actually. I love talking about it because it's our partners in health. And that's what I call them. They're our partners in health. Research is showing that for every 10 bacteria, there's 1 cell in the body. So you can imagine we have trillions of cells in our body. So we have even more bacteria. And so we're an ecosystem almost. And I say partners in health because we have a symbiotic kind of relationship with them. So while we give them shelter and food, they actually take over the any kind of border or barrier system to the outside world. So they're in our eyes, they're in our mouth, they're in our lungs, they're all along down our intestinal tract, through our urogenital tract as well. And while we give them the shelter and food, they actually help us make vitamins, and they actually help us digest food. They protect that lining for us. And believe it or not, the research now is showing that they are able to release chemicals which actually interact with not only our brain, our hormonal system, and our nervous system.
Okay.
Yeah.
So what's the best diet to maintain that microbiome on its own?
Research is showing that actually it's the whole food plant-based diet. Optimizing, even increasing just fruits and vegetables, increasing fiber in your diet is shown to be really helpful for balancing the microbiome. They've done a research study where they actually took vegans, they took vegetarians that were still doing dairy, and then they took omnivores. And what they did was they actually did fecal studies. So they had them do basically stool testing, and they found that the lowest cytotoxicity in the microbiome was for the vegans, which means that it was the lowest form of toxic waste matter, basically, is what it is.
Is it good enough to just be vegan though? Can you tell me a little about SOS and?
Yeah. So the way that we approach nutrition here at True North Health is really minimizing or reducing or eliminating salt, sugar, and oil. And the reason why is because in our world today, we have doubled, triple, quadrupled the amount of oil, saturated oils, not even saturated, but just even concentrated oils, sugars and salt in our food. And now we're finding, this is really contributing to a lot of the chronic conditions out there in the world. Obesity, diabetes type 2. When you look at sodium, a lot of people don't know, but there's a huge immune component to high sodium diets that are attributing to autoimmune cases. So yes, I think that if we can transition individuals to just more plants and vegetables, that's huge. That's a great shift. If we can transition those individuals to an SOS-free, even better. Even better. Yeah.
'Cause I was vegan for 3 years, eating nothing but processed junk.
Right.
Because I just hadn't been made aware of, the truth. And as soon as I switched to taking out oil and eating as much whole food as I could, I really started to feel better. I lost the extra weight.
Yeah.
My cholesterol was better. My blood pressure was better. So.
Yeah. And just as a note, I just wanted to say, people don't believe me until they come here. I've talked to a lot of vegans on the phone, getting them ready to come. And those junk food vegans, I say, they're like, there's no way I'm going to be detoxing just by eating this food. They come here and some of them have the biggest healing crisis just from eating the food because we're taking out the salt, sugar, and oil.
And what is that healing crisis?
So anything that, any kind of really heightened kind of detox reaction or anything that's coming through that creates this, it's a huge physiological shift in the body. So for some people, it's nausea, vomiting. For some people, rashes form. For some people do get really lightheaded as well. So there's just maybe lower energy, like an energy will dip before they start to feel better.
So it's just the body purging some toxins after years or even decades of bad eating.
Exactly.
Okay.
Exactly. Yeah.
So back to the microbiome. Do we need supplements? Everybody talks about probiotics, prebiotics, whatever that is, and other supplements like fermented foods. Are those things that we need to have in our daily diet if we're eating the right way?
I would say no. I do not believe that we need these even fermented foods or probiotics. What I will say is that the microbiome, there's ways that you can create imbalance in the microbiome, and I divide it into 3 different categories. So one is it can be in the wrong place, it can be the wrong quantity, or it can actually be the wrong context. And what I mean by that is that wrong place, you probably heard of leaky gut. So sometimes we invade the barrier, that protective barrier, and so we have these bugs that are actually, or bacterium that are that should just be on the surface of that barrier, are now within our intracellular matrix, and that's what's causing issues. Or they can overgrow. They can, they're safe in their little numbers, but if particular one overgrows, that can cause problems. And what I mean by wrong context is that all these bacteria are really wonderful unless you get them angry, and they can become aggressive. People are shocked to find out that most times the bacteria that actually give us problems are actually part of a normal, healthy microbiome. It's not like there is a pathogenic one that actually attacks us. It's just that there's an abnormal kind of variant to them. And that's as simple as diet, right? Stress can affect that. Antibiotics, depending upon if a person had a C-section or not, for their children, whether or not they were breastfed. These kind of things can really affect how a microbiome is not only produced, but then how they go through life. The reason I said that is because of the fact that also dictates whether or not you need probiotics, prebiotics, or if you need fermented foods. If somebody has some kind of chronic illness, if somebody has autoimmune, if somebody has leaky gut, we have to repair the entire intestinal lining. We have to repair maybe the gut health. Maybe we have to repair the immune system, and we have to then repopulate as a healthy bacterium or healthy balance. So those are the times I would definitely give probiotics.
So it's usually just a temporary fix.
And
then once you're up and running, eating a healthy whole foods diet is going to keep you there forever.
Absolutely. Yep.
Okay.
Yep. Absolutely. I don't think that there are some people that like to do fermented foods just because they really enjoy the taste or it's part of their culture. I don't think there's a negative part of. There's always too much if you do too much, but I don't think it's a negative part of a diet. So,
okay.
Yeah.
So I get a lot of women's health questions, so I wanted to bring that up. Tell us about a healthy endocrine system, hormones, the effect that has on a woman's reproductive life, all the stages,
Sure. Well, I mean, your endocrine system, it's energy production in our bodies. It's as you mentioned, it's our reproduction, it's our growth, it's our development. It's vitally important for our everyday interactions, not only with our environment, but within ourselves, like how our body just feels, how we feel, how we think, how we interpret stressors in life. So I would say that, throughout a woman's reproductive life, there's many things that can come in and out of it. We can have anything from, menstrual disorders. You see sometimes PCOS, which is polycystic ovarian syndrome. Sometimes people lose their menstrual cycle, or women lose their menstrual cycle. Fertility issues can come up as well. And then going through that, you can have something called premenstrual syndrome, which is, women can have a really tough time just even around their menstrual cycle. So all of that goes into healthy endocrine, which is how well your thyroid's functioning, how well your gonads are functioning, how well your adrenals are functioning, and how well that interconnection is communicating.
So what are some of the causes of an imbalance that's causing those cycle-related problems?
There could be a variety of things. One of them, I'll actually start way back. One thing that I will say is that I work with a lot of my patients preconception-wise, and I know I'm taking it quite a long ways back, but it really does start there. It starts with how healthy a mother is, how stressed out a mother is. Studies are showing, and actually the newer studies are showing even telomeres. So telomeres are the end of chromosomes, and they can not only tell longevity, but also how a person kind of fares throughout their life. And the reason I bring that up is that even now in that telomere research, they're showing that mothers who are really stressed out, or if they're not in as healthy of a position preconception or even conception wise, they can actually pass that along to their kids. And so can fathers, more so moms, but so can fathers. And so it's really important to start there and get health there. And then once a child is born, as I mentioned, things can really shift from there. So studies are showing that cesareans, C-sections, absolutely increase children's risk for immune dysfunction, IBD, IBS, allergies, asthma. If a child is not breastfed, those same things can actually come up. You can have increase in allergies, increase in digestive complaints. So right there, that can actually disrupt the endocrine system as well. If your gut and your entire immune system is not healthy, your endocrine system is actually going to be imbalanced. Taking it even one step further, when you're growing up, any kind of stress, long-term stress, if children are, victims of any kind of abuse, even trauma, injuries, what I mean by trauma is even physical, emotional abuse, poor diets. If a kid's just given so much sugar early on, if they're given,
and they are these days.
And they are, yeah, just to do a side note, a lot of people are saying, we have a lot of picky eaters as children. Well, I think unfortunately what we're doing is we're feeding kids sugar too early in life, so they don't even appreciate the natural sugars that food has, or like the fruits and vegetables have. So, but those are some things that really disrupt the endocrine system and really set a person up. So once they hit 12 years old, which is around the average where a woman should be reaching, puberty, they're already having a host of issues because they might not be able to produce their wonderful hormones optimally. And then there's other stressors that come on, maybe not from just school, but also then you have peer pressure from other kids. And then into adult life, you have the chronic overwork that we have now in our society as well. All of that goes into how our thyroid and our entire endocrine system is functioning.
Right.
Yeah.
So with a C-section, what's happening that's causing these problems?
Yeah. So studies show, and this is how fabulous the body is, when you study a woman's vaginal secretions throughout their pregnancy, the vaginal secretions actually changed towards the last term of their pregnancy, and it gets it ready for the proper inoculation for their child. So it gets them ready for the child to actually be inoculated with the healthy microbiome that's going to take them into their infancy. When you do a C-section, you're not going through the vaginal canal, so the child does not get that beautiful inoculation. So they're coming out in the world without that microbiome. And as I just, as we just talked about, that microbiome is everything. It's the way that our bodies talk to the immune system. It's the way that our nervous system is formed or regulated. It's the way that it's a protective mechanism. So imagine that's not there at the start, and they're out in the environment, you're going to have a host of issues. And we see it across the world. So.
Do you find that can be fixed?
Yes.
Are you able to repair that? Same with if a child isn't breastfed?
Absolutely. They are showing, and I'm sorry, you know what? The other thing I forgot too is, remember with C-section, there's antibiotics that need to be given, and so that's part of it. No, to the mom too. So that's part. Yeah, exactly. Okay. But the thing is, breastfeeding actually has shown to kind of negate the antibiotic effects or the antibiotic hit that happens as well. So we do see the studies are showing around 3 to 4 months of breastfeeding can actually really reset or rebalance the microbiome. Okay. So that's one way that children can really be benefited. Also, upregulating or really helping the mother with their nutrition. So switching them closer into a whole food plant-based diet so that what they're giving their children are those vitamins and minerals and nutrients that they need. So that's the other way. Okay. Yeah.
So a couple more things on hormones before we talk more about pregnancy. Birth control pill.
Yeah.
Or other birth control that is hormone based. What are the effects? And like my wife was on a birth control pill for like 12 years.
Yeah.
What can that do to your endocrine system and your cycle and all of that?
Yeah. Well, and the thing, so now we have various types of birth control, right? We have monophasic, which is just basically one steady stream of the same hormone. We have biphasic, which is 2 different dosing, and then we have triphasic, which is 3 different dosing. And we have the Mirena IUD, which is a release of hormone. And what these do is that they not only change change the fluid that makes it pretty inhospitable to sperm, which is a good thing if we want to maybe prevent pregnancy, but it also doesn't allow the lining of the uterus to expand, so you're going to stop a lot of times menstrual cycles from happening, or they're going to be lessened. In Chinese medicine, the reason I bring this up is in Chinese medicine, it's the menstrual cycle for women is a wonderful thing. Actually, in Western medicine too, we should be really, really psyching our daughters up about how phenomenal it is that we go through this menstrual cycle.
It's been around a while.
It has been around for a while. It's in a wonderful time. It gets our bodies, it's a detox pathway. We can really detoxify through bleeding every month too. So it's unfortunate because we're not teaching our daughters as much about how the wonderful positive effects of these. So kids are looking at it as a negative aspect of their lives, and so people do try to use these birth control pills to actually stop their menses. So there's 2 things that are happening there. It's not allowing us to really clean our bodies as effectively as we are born to. On the other side of things, to go more into what birth control does, it also, right, when you're adding in a synthetic kind of or additional dosing of these beautiful hormones that we already make, that totally shifts our entire endocrine balance. So our system is full of positive and negative feedback loops, which means that as somebody calls out, depending upon what's happening there, they call back. So there is this constant communication back and forth. So if you're adding in another hormone into the system, that can be actually turning things off. That can be, we're preventing ovulation a lot of times with some of these. And so that's causing a host of issues along the board because we're supposed to be ovulating. I mean, it's a natural process that we're going through. So we are absolutely shifting the entire cycle. That's why women who actually go on this, a lot of times they get anxious, they have depression, they start losing their hair, they start having acne, or when they come off of it, some of these things come out because you're removing this extra source of hormone that the body starts to be dependent upon, and it doesn't know what to do anymore because it hasn't been functioning in that manner.
My wife was worried. She broke out with acne and her hair was falling out and she was really quite concerned. And finally, after maybe 4 months, is that kind of the average? She started 6 months, that went away. And that's great. But so do you recommend birth? I mean, what can we do instead? What Elise did is she read the book Taking Charge of Your Fertility.
I love that book.
Yeah.
I love that book. Yeah.
And she learned how to chart her cycle, take her temperature at the same time every morning, check her cervical fluid. Yeah. And it's worked obviously very well. We don't have any children.
Yeah. My husband and I use that as well. I've used it for most of my life. I've tried to go on birth control, and I was not able to tolerate anything. So I had to be really, really, these days they call it really, creative with our birth control, but that's what I did. It's a natural method.
So would you recommend that to a woman who's just, who's just had puberty or older, or like, is birth control safe to some extent for a certain amount of time, or would you recommend against it? What are your thoughts on that?
Yeah, great questions. It's, my thoughts with birth control are very similar to my thoughts on bioidentical hormones later on with menopause. And that is, I take every woman individually and I run through the risks and benefits of putting somebody on a hormonal supplement that at that point in time is additional to what they need, right? So, and what I mean by that is in some cases it actually is really helpful for women. Some women have a lot of premenstrual symptom problems. Some women have PCOS, which really is benefited by birth control pills. So it depends upon the woman. It depends upon what they're going through and what they need in order to get to maybe a level where they're more comfortable. In the meantime, working on the foundations of health, making sure their diet's in place, making sure they're exercising, are they happy, are they hydrated, are they doing all these other things, and then getting them to a really safe pace where then maybe we can remove the birth control. But sometimes it's enough where they need to function in life. So I think in those kind of situations, there is maybe a place for them. But like I said, it's also really assessing the risk and the benefit. For most individuals, they don't need to go on birth control pills, especially if it's just for literally birth control. So if you're using it just not to get pregnant, the natural method works really well.
Maybe.
Education works really well. Condoms, which do break, but they're definitely a barrier system. Copper IUD, if you're gonna do an IUD, is a lot better. What the copper does is the copper is a little toxic to the sperm. So basically, there is not the hormonal component, but it just makes it inhospitable to the sperm. So that's how that.
So it wouldn't cause your cycle to go away if you're on the copper IUD?
No, not usually. Not usually.
Okay.
Usually the bleeding or the menstrual cycle is most affected with the hormonal ones.
So how reliable is charting? Is it fail-safe? Is it as safe as birth control pill?
It's very safe, especially if you're doing it monthly. If you're getting really, really closely in line with your menstrual cycle, you can definitely pretty much on the spot.
Lisa's felt very empowered by it because she now understands her body more so than she ever did. And she said, we never learned this in school. We don't understand the fluid. She just thought, one part of the month she's got more fluid down there and other parts she doesn't, and I don't know why, and we're not learning this. What do we do about that?
Absolutely. And also it's a great way because you're understanding your body, it's a great way to optimize your hormones so that if you want to get pregnant, you know what you need to do in order to get there and get ready for it. There's many women I see, and when I ask them about their menses, they don't know their menstrual cycle. When I ask them about premenstrual symptoms or things of that nature, they don't know anything about that, and that can affect fertility down the road. So it's really important to get in touch with that, especially if you want to get pregnant at some point in time. So
right.
Yeah.
So you said you work with women before they're ready to even get pregnant. Is it because they've shown signs of an issue that they want to fix, like they had an irregular period or something like that? Or is it just in general to be safe?
Good question. Actually, both. Okay. So I have had women who have been trying to get pregnant for at least a year that haven't had a child or haven't been pregnant or hasn't been pregnant. I work with them on not only just diet, optimizing their diet. They might need supplementation as well along the way, just to really, really boost these beautiful vitamins and minerals in order to get them healthy, get their nervous system healthy, get their endocrine system healthy. Some women, let themselves go, so they actually don't know that they're hypothyroid. Some women don't know that they have low estrogen, low progesterone. So it's about, identifying some issues that are coming up and actually helping them to rectify them before they even start trying again. Because if they do start trying, there's much more higher likelihood of maybe having miscarriages down the road. So things like that. I work with them on acupuncture as well. Acupuncture is phenomenal for just supporting the entire energy system of the body for consumption.
Tell me a little more about acupuncture in general for both sexes.
Acupuncture, so when I was in medical school, I'll tell you my little story. When I was in medical school, I decided to get acupuncture just because I was so stressed out and there was just so much work to do. So when I went, I saw immediate benefits, just my energy level, my digestive system, how I was able to memorize, information. And so I decided, my school thankfully offered a program where you can kind of, on top of your doctorate degree, do a master's in traditional Chinese medicine. So that's how I got into it myself. Chinese medicine and acupuncture is wonderful because what it does, it's a very practical and very it's based in thousands of years of practice and observation, and what it does is it basically balances the entire body. It balances hormones. It allows the digestive system to work better. It allows the nervous system to really optimally, conduct information. And what you do is the idea behind Chinese medicine is that they work a little bit differently than the idea of Western medicine, and it works on different channels in the body, and sometimes just because of diet, because of injuries, because of our lifestyles, we can cause blockages in these different energy channels. And so if you are not getting, it's almost like circulation, if you want to think about it that way. If you're not getting circulation throughout your body, you're not getting vitamins and nutrients. So things are going to start to maybe they're going to have necrosis, or you're going to have a little bit of decay. Same idea in Chinese medicine. If you don't get energy throughout the body, you're going to start having problems. You're going to have organ dysfunction. You're going to have things that are just not working optimally. So what acupuncture does is that it can really work to create that energy system to work optimally. And then there's specific points that actually go and they optimize just even how the organs work themselves. So there's various points for that. So for men, I've seen men from everything from, just fatigue. It can work with pain. So we can work on like different kinds of osteoarthritis, different kinds of even injuries like knee pain, ankle sprains. Back is a really common injury as well, all the way to infertility, even for men as well. I've worked with circulation and cardiovascular disorders, metabolic diseases, so like diabetes. There's even ear points. So the ear is actually a mirror of the entire body, and so you can work with the ear to help with addictions, help stop cravings and decrease appetite for people who are trying to lose weight. And then for women, of course, everything from and men too, with hypothyroid to different kinds of endocrine reproductive issues as well.
Fascinating.
Yeah.
So jumping back to pregnancy.
Yeah.
Prenatals, supplements during pregnancy.
Yeah.
I wrote some down. I had, obviously vegans already need some B12.
Mm-hmm.
Do pregnant women need even more? Do they need folic acid, preformed DHA, vitamin D? What's the scoop?
Good question. If a woman is vegan, more so if they're whole food plant-based, and I'm going to make that distinction because again, like as we talked about, we can be junk food vegan. If they're whole food plant-based vegans, what I mean by that is that if you're getting enough vegetables, fruits, and you're getting a rainbow, grains, legumes, nuts and seeds, like healthy fats, if you are, and you can say that you're getting a good amount of a beautiful balance of those at least 3 times a day through not only preconception but during conception and then during pregnancy as well, actually you probably don't need additional supplementation except for B12, because we don't get that in our food. pregnancy doesn't need more. I would say on average you can do like 25 micrograms per day of B12, or you can do 1,000 a couple times a week, or some people like 2,500 micrograms maybe once a week. Whatever that is for you, you can kind of break it up into different things. With DHA, we need around 200 milligrams. Believe it or not, if you're eating a really healthy, variety of whole foods, you can get that through your foods. I mean, DHA is in your flaxseed, it's in your chia seeds, it's in your pumpkin seeds, so you can get that. You definitely need a good dosing of like zinc. Zinc is really important. You need your B vitamins, you need your vitamin A, but again, you're getting that from your diet. Yeah, you definitely are. I will say that if a woman is working, and this is what I see a lot of times in my practice, I see working pregnancy women who pregnant women, I should say, they maybe aren't getting the best nutrition, even though they're whole food plant-based and they're really trying hard. That meeting, they're rushing, they're stressed out, they have a lot going on. Those are the individuals I think about supplementing, because they're using up those supplementations, they're using up those vitamins and minerals maybe a little bit more, so they might need a little extra.
You're gonna eat more calories when you're pregnant, right?
Yeah, absolutely.
So you need to be eating more often. I mean, I suppose
absolutely
your hunger kicks in, right? And so it should happen mostly naturally that you're going to eat more.
And not only that, but one
to
thing that happens is nausea. So nausea is a really morning sickness, is a really big thing that happens with pregnancy. And one of the best ways to combat that is just eating frequently throughout the day. So I always tell my pregnant ladies, be a grazer. I know, in the normal world here, even in True North, we always talk about intermittent fasting. Not during pregnancy. During pregnancy, be a grazer. That's really going to help decrease morning sickness too.
Is morning sickness based on diet too? Because I've heard some talk about morning sickness related to a meat-based diet or dairy or things like that. Is there a correlation between those things, or is it just something everybody experiences?
Not everybody experiences. Truthfully, I haven't looked at research to see percentage-wise whether it's meat-based versus vegan, or what the combination is. I will say that in my practice, I see it from all different areas. I've definitely had vegans that said, I'm doing fine, I have no morning sickness. But then again, I've had vegans that are really whole food plant-based that follow this type of diet, and they do have morning sickness. They have pretty, severe morning sickness. So I don't think I do think diet plays a huge role. I don't think that it plays into whether or not morning sickness is as prevalent. Morning sickness is primarily due to the increase in the different kinds of hormones. So HCG, specifically estrogen. So and then in some cases, people get morning sickness really from low blood sugar, or just not really stabilizing their blood sugar throughout the day, which is where that grazing can come along. So
okay. Sorry, ladies, you're not off the hook even if you're eating right. So breastfeeding, how long should a child be breastfed?
Yeah. So I would say no less than 6 months. You can definitely breastfeed up to say 2 years, 3 years. I usually recommend women start to bring in solid food around 6 months. Okay. But even when they're bringing in solid food at 6 months, you can definitely supplement it with breastfeeding up to, like I said, 2 years. I think the American Association for Pediatric, I think that they say, they're general. If a woman can breastfeed any amount of time is more benefit than not breastfeeding. I think they say around 4 to 6 weeks is their minimum. For me, my minimum is 6 months. I think that a woman should definitely try to do 6 months at least.
And what if there's some reason why a woman can't breastfeed? They adopted, or I don't know, what other reasons can you think of, first of all?
Well, good question. So what I would say is sometimes women run the problems of having problems with attachment to the nipple. Some women have issues with even producing milk as well. And for those women specifically, I would say first go to a doctor and see if you can get not only counseling, there's actually midwives, there's definitely OBGYNs nowadays that do counseling and help women with attachment, or they can help women. There's a lot of great herbs as well, like fenugreek.
Yeah.
That's a tongue twister. Fenugreek that actually can help with producing milk as well. So there's ways that a woman can actually stimulate milk production too, if that's part of what's causing it.
Okay.
But if really truly like a woman cannot breastfeed, then what I would say is, of course, there are infant formulas. There's a couple of soy formulas, I think the most important thing to think about with soy formulas are, making sure not only are they non-GMO, number one, so getting the best quality, but also making sure that they have iron in them, and making sure they have DHA, because those are things that a child can have up to 6 months, and then even at that point in time, we have to start thinking about iron supplementation, so making sure that they have enough.
So the baby's obviously not going to be getting some of that microbiome stuff we talked about.
Right.
Are you seeing that can still be fixed with proper diet as they grow?
Yeah, absolutely. And not only that, but if that's an issue, then we can start even doing probiotics at an earlier stage.
Oh, okay.
So we can definitely do it, even at babies, infants.
Okay. So with overt fats, which is what I call, nuts, seeds, avocado, coconut, olives, soy, do women need that more so than men do in general, not just with pregnancy or breastfeeding? And so what's the story on overt fats? I get that question a lot.
Okay. I would say that, overt fats are important to the diet. And, when you look out there, especially in the craze of the low fat diets, even low fat vegans, are out there. I would say that, on average, if a person is getting, I would say actually on average, a person shouldn't be getting less than 15% of their caloric load of fats, basically, across the board. So no less than 15%. For women who are of childbearing age, I do kind of up that, and I say try not to get less than 20%. So 20% of their total calories. So there is a little bit of a difference, not by much, 5% probably. For most men, if they're really pushing it and they just are like, what's the lowest kind of percentage that I can go, I go 15. With women, I go 20. So their total calories.
And does that change during pregnancy or at different stages during your cycle in general?
Oh, good question. Yeah. So with pregnancy, you can definitely increase that number for sure. And also, like I said, you can even do a little bit of supplementation just to make sure that you're getting at least that 200 milligrams of DHA, which is totally the baseline that I would say with the DHA. It's interesting that you brought up the menstrual cycle, because one of the things I do with menstrual cycle or menstrual cycle regulation is I actually do a seed rotation diet.
Oh, really?
The beautiful, as I mentioned, chia seeds, pumpkin seeds, flax seeds, they upregulate your DHA EPA, which is also part of the omega-3 pathways, which is more the anti-inflammatory pathways. And that's also something that supports the estrogen dominant part of the cycle. So sometimes what I'll do is I'll put women on those kind of seeds and kind of upregulate them days 1 through 14 in their menstrual cycle. And then what I'll do is on days 15 through 28, 29, whatever their cycle length is, I will do more of things that actually upregulate or support the progesterone part of the cycle. And that's usually things that also support omega-6, because omega-6 is important. We just want a more balance between the omega-3s and omega-6s. And those are your sesame seeds, your sunflower seeds. So I sometimes play around with that with women to see if we can balance their cycles. So, yeah.
Excellent.
Yeah.
So how about the diet for children? Is it different from our diet as adults? Do they need to just eat more of it, or do we need to just fill them full of dairy to build those strong bones?
Oh my gosh, that's so scary to me. I've actually seen, as probably many of us have seen, I've seen much more problems with drinking that full glass of milk or dairy throughout their lives. So they absolutely, if they're whole food plant-based, some of the most some of the healthiest, most vibrant children I've seen have been whole food plant-based. So it is definitely possible and actually beneficial to really optimize a child's ability to live this life by doing proper, fruits, vegetables, legumes, grains, and nuts and seeds. So healthy fats. Kids are so intuitive. That's the beauty of them. They will eat when they're hungry, and if they're not hungry, they just will not eat. And listening to them and understanding like what they need is going to be the best kind of care that you can give them, truly. And as I mentioned, not starting them off with sugar, because when you start them off with sugar, it is going to be harder to switch gears. It is going to be harder.
Calibrating them,
right?
Absolutely. They're going to want it.
They're gonna want it.
Been there.
They're gonna want it. Yeah. They're not gonna, it's just like they're not gonna appreciate that actually zucchini has sweetness in it. The beautiful flavors of their food. And that goes to also understanding that this is where you want to be spending money. You want to be spending money on organic foods, that are really vibrant and full of flavor, because then your kids are gonna want it too. They're not gonna want these dull, pesticide-filled foods that don't taste like anything, because they're just like everything else too. So there's also a flavor component in that.
Awesome. Well, tell me about nightshades and inflammation. Who might have problems with them, and how that all works.
And what are nightshades? What are nightshades, right? Yeah. So nightshades are part of a part of a family called Solanaceae family, and the constituent within this nightshade group actually has been shown to cause some issues in, a lot of times, most specifically in joint issues. So osteoarthritis, even rheumatoid arthritis, those kind of conditions that are most affected in our joints. That is not to say, though, there are some individuals in the population that just don't do well with these. And truthfully, here's the little fun fact, right? I mean, this constituent is actually something in the plant that's a protective mechanism, right? So the more organic, the more healthy you get these plants in these soil, the more of that constituent is actually going to be in there. So you're actually going to feel it the more when you have these beautiful organic like fruits and vegetables. And it doesn't necessarily mean that the plant is bad, right? Or these foods are bad. It just means for some individuals, they actually cause a little bit more inflammation than other individuals. These are different foods like tomatoes, we think about, potatoes, green peppers specifically, so just the green peppers. Okay. We have tomatillos, believe it or not, cayenne pepper.
Eggplant one?
Eggplant is one of them, yeah, thank you. Eggplant. Goji berries, believe it or not, are part of these.
Oh, that vegan superfood?
No, I know. And so on the flip side, not only do we see some issues though with joint related conditions, but we, in some cases of autoimmunity, where already we have a breach of that barrier, nightshades are one foods that I just tend to have people maybe wait on, because they could potentially cause some kind of flares. But again, not everybody, just certain individuals.
Is it usually lifelong for those people that do have issues?
Not always. Believe it or not always. It depends upon what's going on with the individual, and it depends upon also what other things they're bringing in that's really a health promoting factor in their life. So what I mean by that is that, say on the autoimmune conditions, actually individuals that maybe heal their gut, and maybe they have had leaky gut, they heal their gut, they weren't able to do, say, potatoes, they weren't able to do tomatoes, down the road they might be able to, sure. And not all of them have the same level of these constituents either. So I've had individuals that said, I can't do tomatoes whatsoever, potatoes are fine, or vice versa, so it depends.
So I made that joke about goji berries, but what's the scoop on, taking these superfoods and extracting the maximum amount of nutrients out by blending the carrots instead of eating them whole and all these things? Do we need to worry about all this crazy reductionist nutrition?
Yeah, I think there's a time and a place even for, like, say, juicing, because juicing, you're concentrating those beautiful phytonutrients, and I support individuals when they want to go through their juice cleanse and just optimize their health. I think that's really amazing. But we have to look back in history, and we didn't ever have to, like, reduce things down and have this vitality. And truthfully, when you look at longevity studies, when you look at even societies that are living to be 100, which is a really good, basis or factor or things to look at as to how do we get this optimal health. People aren't doing those reduction techniques. They aren't living that. What they're doing is they're doing this diet. They're doing the things that that we recommend here. It's that they're having a supportive community. It's what you're doing. Having a community where people feel supported, where they can talk to each other, where they don't feel they're crazy because they're changing their diet and they're not taking medications instead of using food as medicine. People feel crazy in this world because it's we're still the minority in this revolution kind of in this progress. Making sure we're moving every day, making sure we're getting hydrated, making sure there is not only the vital nutrients, but also people are sleeping, people are resting, there's stress management techniques in place. So those are the things that are going to give you optimal health. I don't think that people need to go into this reduction. What I will say is that for me, what I say to my patients is, if you're having a rainbow of foods, like if you can honestly look back in your day and you said, I pretty much covered the colors of the rainbow in my diet today, I say you've done it. You've done it. Yeah, you've gotten, with each of those beautiful different colors, you're getting some beautiful constituent from it, whether it's vitamin A, whether it's anthocyanins with it, whether it's carotenoids, whatever it is, you're getting it through that food. Yeah, so
Perfect.
That's my rule of thumb. So
Awesome.
yeah.
Another question I get a lot, and I have this question too, personal hygiene products. Which one? I know that when we're fasting, we're not putting anything on.
Right.
When we are not fasting, what should we be putting on? What kind of shampoos and deodorant and toothpaste and soap should we be looking for? Is there specific things we want to avoid?
So what I usually direct my patients to, just because I think that what I get a lot is I can't make my own products at home. I just don't have the time, because that would be probably the best thing. So when you're thinking about house cleaning, house cleaners or just multi-purpose cleaning, I always think of baking soda. Baking soda is something you can buy for $1 and it's wonderful. But a lot of times, in order to make some products, you have to mix it with vinegar. Sometimes, and even baking powder is actually, baking soda is really good for toothpaste, believe it or not. So you can use it to brush your teeth. Some people just don't want to. You can add a lot of essential oils to that combination as well to get some, different kinds of smells. And also you have eucalyptus, which is antibacterial, antimicrobial as well. So these can be your cleaning products. Some people don't want to do that. So then if you actually go up on EWG.org, so it's the Environmental Workmen's Group.org, they have a wonderful website where they actually list out almost every single, I've yet to find a product that I found in the world that they don't have, truthfully. And they rate it. They rate it on not only toxicity levels, but if there is anything that they don't, actually they'll go to the company and say, wow, these people didn't even record these certain kinds of ingredients, so they're really good. So they have a really good informative website that's really easy to use. Going back to products though, some of my other favorite ones is using like coconut oil for a deodorant, or for even a lubrication, for a moisturizer. Some products that I love is there's a Eminence, which is what we use here. You can actually eat their products. Like, that's how natural and how wonderfully like high quality their products are. Is actually you don't want to, because they don't taste that great, but you can eat them in the sense that it's not dangerous. So those are some things like that. There's a lot of you can make your own soaps too, believe it or not. There's wonderful ways that you can make your own soaps, even from coconut oil. So, so it depends upon what level of interaction and how much time you want to spend on it. But there is a lot of really great information, like I said, on
But would you say that the run-of-the-mill toothpaste and deodorants that are being used out there have some problems?
For sure. Yeah, even the natural ones.
Okay.
You have to be really careful these days, because even if you're seeing some words, and this is how I always use it, if you're seeing some words that you just can't even pronounce, or you don't even understand what they are, you've never seen them before, that should be a clue. Not all of them are going to be, you know, endocrine disruptive and highly toxic, but they could have some toxicity involved in them. Right. So it's worth it to kind of investigate them a little bit more. So yeah.
So how about seasonal allergies? What's the story? Why do we get them? Is there a way to make it better, or are we stuck with that forever?
So seasonal allergies happen because of the fact that, again, you have a something in the environment that, you know, whether it's different kinds of trees, whether it's pollen, whether it's, you know, some people also have, well, I'm going to take it one step further from seasonal allergies, maybe like danders, feathers, you know, okay. Animal hair. Those in some bodies create a response that basically releases histamine, which then causes your nasal congestion, your sinuses to become inflamed, and it's basically an inflammation response in the body. And that can happen for multiple reasons. One is that, again, if somebody hasn't set up their microbiome appropriately from earlier age, you actually are much more susceptible specifically for allergies, because your immune system is a little bit, it's not as well regulated. So little things like that, where, you know, for most individuals, you should be able to walk out, right? And we're bombarded by a ton of things when we walk out there. But the fact that somebody's immune system is reacting to every single little thing, that means that the immune system is a little bit off balance, or it's just not as healthy. And so that's one aspect of it. The other thing is diet, right? So you can start off with a really healthy immune system or a healthy microbiome, but through diet, you're actually increasing inflammation in the body. So that offsets the immune system, and that offsets how your endocrine system is working, which then, you know, talks to the nervous system, talks to the immune system, talks to everything, which then creates such an imbalance that you start reacting to everything. And diet can also contribute to leaky gut. So leaky gut has a very specific role in it, where now because you're breaching that barrier, any little allergen, whether it's environmental allergen or even food, is then causing a reaction in the body. So because it's going into the past the barrier.
So the best cure is diet.
The best, well, truthfully, we see a lot of benefits from water fasting. So we do see a lot of benefits from fasting. Diet is extremely helpful. One of the best things I've seen help is just getting rid of dairy. If there's one thing you do, just get rid of dairy. And I would say, I don't even know what the percentage is, but definitely more than 50% of people say, I gave up dairy and my allergies are so much better. Like, I don't have that runny nose, I don't have that postnasal drip anymore. So right there, you're just making an improvement. And then, of course, the more you optimize your diet, the better it's going to be, because then you're going to also help the microbiome, and you're going to help your immune system. You're probably going to be sleeping better, which then helps, you know, your immune system, which then helps the allergy reactions. So
fantastic.
Yeah.
Well, this has been wonderful.
Yes.
Thank you so much.
Thank you.
Great opportunity for me and for everybody in our group and that'll see this.
Yeah.
Your work's amazing.
Your work is, thank you for doing what you do. I mean, it's wonderful, because this really is something that we need to do in a concerted, you know, fashion, and kind of, it's a revolution, right? It's really,
the information's not getting out there because it's not being taught to us.
Yeah.
And so
that's why we need
this
teachers.
Is the way to go.
Yeah, absolutely.
Thanks for everybody for watching, and we'll see you on the next video.
We're telling people to eat their whole foods, so fruits, vegetables, grains, legumes, nuts and seeds when appropriate, and avoiding meat, fish, fowl, eggs, dairy products, oil, salt, and sugar.